Hello, I'm Laura Libman, founder and CEO of the TIA Foundation. The TIA Foundation trains and equips community health workers elected by their fellow villagers in remote rural areas where there are no doctors or health care. During a training project, we also provide free medical care to the residents in these communities. I was asked if I would share our risk management strategy for taking personnel into the field during a pandemic. So here it is. The first thing, and maybe the most important, is planning. You should write out clear instructions for each group of stakeholders and inform them of your plan at least 2 weeks prior to departure. As an example, here are the preparations that TIA made ahead of our June volunteer and field partner trip when traveling to a small municipality in central Mexico that had no COVID cases. Since our mission mandates that we work in areas where there is little to no access to doctors, medicine, or health care, and we work with extremely impoverished farmers, we took our preventative measures very seriously. There are no ventilators or canisters of oxygen where we work, so it was imperative that we did not infect the local population. We put careful thought and consideration into whether or not we should even do the project and how best to protect all those involved. After careful consideration, our board decided that if we didn't do the project, the people would have no trained personnel and no PPE when the virus did hit that area. And the area covered about 15,000 people. So we decided it was best to go ahead with the project. In addition, we had purchased a robust liability insurance policy, which was in place at the time of our trip. This policy included air evacuation to the US in case one of our team got sick. And I cannot recommend this strongly enough. Having good insurance protects you, your board, your staff, volunteers, field partners, as well as the organization itself. It could devastate your organization, possibly forcing you to close your doors, leaving those you serve vulnerable if you don't have proper coverage. So about a month before our departure, we consulted our doctors and researched protocols for frontline health workers on how to protect themselves from biological contaminants. About a month ahead of the trip, we purchased KN95 face masks. We also purchased face shields, disinfecting wipes, and strong hand sanitizer. This is not as easy as it sounds because at the time, which was May of 2020, PPE was in short supply to the general public. We opted for KN95 masks rather than N95 masks because they were nearly as effective, and we did not want to take N95 masks away from hospital workers who have a more urgent need. To be clear, make sure if you purchase a KN95 mask that it is a high quality mask and has the best possible face seal possible. You don't want any gap at all between the mask and your face. We mailed the PPE I just described to each person who is joining us on the project 2 weeks prior to departure. 3 weeks prior to departure, we held a mandatory Zoom call for everyone planning to join us in the field. During this call, we went over the itinerary and provided details about how to travel appropriately to avoid contracting the novel coronavirus. We also required everyone to watch the WHO video on proper hand washing techniques and made sure everyone understood that they were to follow this technique for at least 20 seconds, but preferably for a full 2 minutes. We required all those joining us to get COVID-19 nasal swab testing up to 10 days ahead of travel. And every person was required to provide a copy of test results confirming they had tested negative for the virus. After testing, all were required to self-quarantine in their home until the departure date. Okay, now the trip. Now it's time to execute the plan that you so carefully developed and reviewed during your orientation call with your team. Here is how Tia managed to travel. We called everyone who would be joining us about 2 to 3 days before the departure to check on everyone's test results, make sure that everyone had received their PPE, and to refresh everyone's memory on the travel protocol, which was that everyone would put on their KN95 masks and their face shields before they walked out of their doors at home. And they would remain on, unless they were eating or drinking, of course, until they were picked up and in the car at the Guadalajara airport. When they were able to remove their face masks inside the vehicle, they still had to leave on their KN95 masks. Absolutely no touching your face, which is surprisingly hard to remember. Having disinfecting wipes handy is marvelous. You should not touch any surface during travel without a wipe between you and the surface. So for example, if you are taking Uber or another form of transportation to the airport, you would use the wipe to open the door, wipe down the seat and seat belts, and use the wipe to close the door. Then you would discard that wipe. Once you are at the airport, use a fresh wipe to pull out your credit card or your passport or open the bathroom doors. Use the wipes on the plane to wipe down your seat and seat belt, open your tray table and wipe that down too, or when you need to go to the bathroom to open the bathroom door. Continue to use these wipes until the vehicle picking you up, in this case in Guadalajara, and you have already cleared customs and immigration. You should also have your hand sanitizer handy too, and be ready to wash your hands frequently. Of course, hand washing is required after using the bathroom, but we also requested that during the duration of the entire trip, that our team wash their hands every hour to 2 hours. When hand washing is not available, you should use your hand sanitizer liberally. When using hand sanitizer, it should be at least 80% alcohol, and the proper way to apply it is to apply enough so that as you're rubbing it into your hands, it should take about 30 seconds for it fully to evaporate or absorb. While we were on the trip, we had a solid and clear written plan for everyone to refer to, and you should too. This is how my org handled our staff, our medical brigade, partners, and volunteers during the trip. We required everyone to wear their KN95 mask every time they stepped out of their hotel room. Once again, we required hand washing, if water was available, every 1 to 2 hours, and hand sanitizer applied properly when water wasn't available. When we were near patients, during our morning consultations, for example, or doing the COVID filter at those consultations, we all wore a mask and a face shield and passed out masks and hand sanitizer to each patient. So we had a strict triage set up. The first triage was our COVID filter. And if anyone was symptomatic, they went to a separate zone. And then they went to normal triage if they were asymptomatic. If the patient was symptomatic, only the medical professionals handled them, not our field partners, not our staff or volunteers, and they were in a separate area. After each patient, we each thoroughly washed our hands. Then later, when we returned to Guadalajara, where there was already a small percentage of positive cases, we always wore a face mask, and it was required in Guadalajara. So I encourage all of you before your travel to be very clear on what the rules and regulations are, not only at your destination, but all of your travel stops as well. In Guadalajara, people would pull over cars if there was more than one person in the car and they were not all wearing masks. When returning to the US, the risk to your team is more personal than on the trip out. But I think it is wise to make some recommendations. The recommendations we made to our team was that we suggested they continue to use the same PPE, the mask and the face shield, and follow the same protective behaviors on their trip home as they did when they were coming to Guadalajara, since each was traveling through a minimum of 2 international airports. We also recommended that they self-quarantine upon return. Since it takes 4 to 5 days to test positive after exposure, even if you are asymptomatic, we recommended testing on day 5 or 6 and remaining quarantined until the test results came back as negative. After we returned, thankfully, all of us tested negative. And our biggest fear, as I mentioned earlier, was that we would bring COVID to an area that didn't have it. According to local officials, there are still no reported cases of the novel coronavirus after the project. So we were very grateful for that too. I hope you found this short video helpful. Please consider thanking my organization, the TIA Foundation, with a small donation if you found this information useful. You can find us at tiafoundation.org. TIA is Tango India Alpha, or Ant in Spanish. You can also find us on any social media platform. Everyone, please stay safe and healthy, and thank you very much.